From Evan Zemer, advocating for a health advisory committee with a medical advisor. From Megan Ward Harvey, concerns about outdoor lunches and close contact protocol. From Shelby Havonen, about outdoor lunches. From Drea Marks, about social distancing, tents at Center Pepin, outdoor lunches, and options for remote learning. From Leah Ewing, advocating for outdoor lunches. From Evan Zemer, advocating for outdoor lunches, concerns about contact tracing, expanding the COVID advisory team, fabric masks versus KN94s, the protocol around windows and fans, and protocol around music classes. From Ben Hersey, sharing a document that was from a meeting held with committee member Laurie Garcia and a parent advocacy group with a list of COVID-related concerns. From Megan Kelly, advocating for outdoor lunches. From Angela St. John, about outdoor lunches. And from Pilar Goldstein Dia, asking the committee to be a voice for the most vulnerable populations.
Okay, thank you. Dr. Leclerc, did you have any announcements you wanted to make before we go on to gifts? Okay.
Yes, I do. Thank you. Just a few things. I wanted to let everyone know that tomorrow night, the Easthampton High School will have its open house from 6 to 8 p.m. via Zoom. Information has been emailed out to all the families. And switching gears to routine COVID safety checks, we're still encouraging families to sign their children up for routine COVID safety checks. Our testing program, formerly known as pooled testing, it's a crucial layer of protection for our students and staff in schools, especially our younger students under 12. Vaccinated students should sign up as well to ensure we keep all members of our community as safe as possible. We currently have about 60%, 60, of staff and students signed up, which is great, but we're hoping to increase that number to ensure we really maximize the benefits of this program. For any families that would like assistance or would like to offer any assistance with this effort of getting parents signed up, we encourage you to reach out to Jean Libby, who is our family engagement coordinator. Her email has appeared on several documents. It's jlibby@epsd.us, and her office number is 413-529-1500, extension 142. She's working with our principals to have a group of volunteers helping family members sign up for routine COVID safety checks in person after school, coming in the coming week or so. Additionally, if parents are interested in assisting our lunch monitors at the elementary and middle schools, they should also contact Jean to get the process started. Volunteer lunch monitors are needed in the event one of our paid staff is out. Lunch monitors assist students in making sure they are following safe lunch practices for both indoor and outdoor lunches, depending on weather. In order to volunteer, folks will need to complete a fingerprint and background check and, of course, be vaccinated. We do need a few more folks, so if you're willing to help, contact Jean. And finally, switching gears again, the Mountain View School project is moving along nicely. And we have a transition committee that has begun meeting. And I'm hoping to bring an update at my superintendent's section of the agenda at the next school committee meeting. Thank you.
Thank you. Okay, do we have gifts?
I do. Like to make a motion to vote with gratitude from a gift from April Judd of ESP Auto for the donation of school supplies, snacks, and playground equipment to the students of Center and Pepin schools. And also with appreciation and gratitude to Robin Bielecki from the Easthampton Community Center for the donation of masks, school supplies, and hand sanitizer to the students of Center and Pepin schools.
I'll second that.
Okay, thank you.
Thank you for
Um,
everyone who donates.
So let's just roll call and accept those gifts. Lori,
Laurie Garcia, aye.
Marissa,
Marissa Crary, aye.
Shannon,
Shannon Dunham, aye.
Maren,
Maren Goldstein, aye. Thank you.
Mayor? Oops, you're on mute.
Mary LaChapelle,
And Sydney Kuzinski, aye. Thank you very much. All right, I'd like to open this up to public speak. Again, I'm asking that you limit 3 minutes per person and say who you are. And please, I'm going to start scrolling through, but public speak is open now. So make sure you signal if you do want to talk. Omar Gomez has raised his hand. Omar?
Yes, I did. Thank you. First, thank you, Madam Chair. Muchas gracias por la oportunidad de dejarme hablar en esta reunión. Estoy empezando en español porque desde el 15 de septiembre hasta el octubre 15 se celebra el mes de la hispanidad. So now I'm going to say in English. Thank you for the opportunity to let me talk in this meeting because as of September 15 to October 15, we celebrate the Hispanic Heritage Month, right? I just want to mention a few people in our community, especially at the school department, because thanks to them, they are really sample for a bunch of kids, especially for the Latino kids and the Hispanic kids, and they are paving the path for those kids. So I want to say thank you to Ivelisse, to Cindy, to Sydney, to Mr. Alvarez and Gabriel, and I'm sorry if I'm missing someone that I'm pretty sure I'm doing it. Like, I'm sorry about that, but thank you. We start this celebration on September 15 because on September 15, 5 Latin countries celebrate the Independence Day. That's why it starts September 15 or September 1st and then ends on October 15. Again, thank you so much for the Hispanic that are working really hard in our community, in our state. We are here to help, to work with you guys. We are not here to take your jobs. We are here to work to be partners. That's why we are here. And we are part of the community, and we want to keep working with you guys to make it something better. Thank you.
Thank you. Anybody else? I'm scrolling through. Alexandra. Go ahead. Welcome. You're on mute. We can't hear you.
Are you hearing me, Cindy?
Now we can.
Okay, apologies.
Oh, that's all right.
And thank you for your patience. So I was saying that I have been a lurker at school committee meetings for a long time, but felt moved to speak last week beyond the point that we are allowed to do so. So committed to myself that I would join tonight to express the incredible both gratitude and empathy that I have for those that are working in our schools right now, especially our homeschool, which we have had a wonderful experience in as a family and feel really supported. So I want to make sure that folks that are, in these really hard positions, especially when they become our health, our public health officers in the last few years, know that so many of us are grateful for your service, both on the school committee and certainly within the school buildings and administration, and certainly the teachers that we've had. One lingering question that I have as a parent, so this may be open-ended, and I understand that you can't answer this question necessarily directly, but last year I was greatly comforted by the COVID advisory team, even meetings that I couldn't attend, to know that there were multiple folks that were deeply committed to making sure that the decisions being made were in the best interest of the safety of all of our kids, gave me a lot of comfort. And I'm just having a little bit of trouble understanding this year why it looks a little different. And maybe it's because certain people are not at the table by choice or by the way that it's designed. But I don't think we're quite out of this yet. And I think we all know that, and it's going to be perhaps a hard couple months here before we get our kids vaccinated. And I would think that it would also take pressure off the administration to have other people at the table, such as someone from the school committee, maybe another health advisor. I think a lot of Megan Harvey and appreciated what she did last year. But just hoping to see more rigor around that group, more reporting coming out from that group, and also an easy way to ask questions instead of bothering Dr. Leclerc every time I have one. Just a hope that we continue being rigorous around that advisory team. So thank you and appreciate all you're doing.
Thank you. Anybody else? Scrolling through. Speak now, signal now. Okay, I do not see anyone. Marissa, do you see anybody? Okay, so we're going to close public speak. Thank you. And we are going to go on to our updates. Policy Subcommittee.
Sorry about that. I couldn't get it off mute.
Okay.
We're still trying to find a date to meet. As soon as we do, we'll keep you posted.
Okay. All right. And part of that is going to be about updating, I think, mask policies. Was that it?
Yeah, but nothing has changed. I mean, it's not going to change any more than what has already been put out.
Okay. All right. All right. Finance.
We have not met.
Okay. And Jonathan has not been able to get here yet. He is coming, but I believe, if I remember from when I was on the collaborative team, I believe the meeting is on the 28th. I think it's the last Wednesday of each month, so I don't believe that he has an update. All right, COVID advisory update.
That's me this evening. So we held a meeting today, and just because there seemed to be some questions, I'll review who's on the committee. Sarah Mochak returns again as our facilitator. I am on that committee. The union president, per our memorandum of agreement with the union, is on that committee and has a seat at the table. The health director for the city is a member of that committee. That's Bree. The city health nurse, when we hire someone, will be on that committee. We have, last year we had one RN in the district that was attending the meetings. The other RN was on maternity leave, but we have 3 RNs, BSNs in the district this year. So the 3 RNs are members of that committee. And Laurie Garcia is our school committee person. She was unable to make it today, but she may make future meetings. Today we discussed at our opening meeting the what we revisited the role and function of that group. It's different than last year, simply because we're not in a situation where we are factoring in whether to open school or close school or go into remote. The guidance last year was much more infrequent and often conflicting among bodies. But this year, you know, we have kind of a steady path forward. And so we decided that really the group discussed that their priority is really to review and advise on the CDC, DESE, and DPH guidance. If there are any changes to the guidance, any updates, this committee will review that and help me interpret that data effectively, or that guidance effectively. And they'll also, we decided that we will look at trends in the community and schools to see if there are any adjustments that we need to make in our course as we move forward. Today we reviewed our isolation room practices. We talked about close contacts and discussed our mask mandate, both at the city level and in our schools. We also briefly discussed the challenges we're having around routine COVID safety checks and getting that up and running, and test and stay. So those are the things that were on our agenda today with that group. And I think that's all I need to let you know about that group. We convened, we only met for about an hour. So that's what we covered in that hour. So I'm happy to take questions if I can, or move on.
So Maren, and then Lori.
Thank you. So maybe along those lines, and I'm not sure if this is the right moment to discuss it, or if there's another point in the agenda, but we had talked about revisiting some of the different COVID-related topics. And one of those topics that I would like us to have a little bit deeper conversation about is around what is the, excuse me, the DESE distinction between close contact. I think there's a lot of, I mean, there's guidance, and I've already seen it in terms of how we've communicated it out as a school district in stating different things in different ways from different schools. And so I would like us to start at least with understanding what your understanding of that is and what the guidance should be coming from the school district that is school-wide, I mean, district-wide, not individual to our school buildings, I assume. And then would like to further the conversation based on that information to discuss if that is enough we need to have a policy discussion around that with concerns. So if you could start, Dr. Leclerc, just by sort of clarifying, again, what are the primary issues or primary key points that makes up close contact?
Yes, I'm pulling out my papers because, you know,
Yes, I
I'm prepared
understand.
for you to ask. But I do want to be clear because this topic did come up at COVID advisory today. So I want to be clear that the guidance we're following as a school district is the DESE DPH guidance. But in the matter of close contacts related to the school setting, the CDC, DESE, and DPH all say the same thing. So all three groups, or all three of the sources that we say we are relying upon, are all unified. Because I think that as a committee, we also kind of, I don't know if we said it explicitly, but we indicated that if any of them differed, we would probably go in a more conservative direction. But to be clear, all three of them say the same thing. And so we discussed it at our COVID advisory meeting today. I'm going to read you the definition. And this was in, I don't think the last update that I did last week, but the update before that I sent to families. So a close contact is defined as an individual who has been within 6 feet of a COVID positive individual while indoors for at least 15 minutes during a 24-hour period. And then there are all the exceptions underneath. But that definition is universal between the CDC, DESE, and DPH. The exceptions for it are also universal between DESE, DPH, and CDC. So we are following that guidance to the best of our ability. And I think we're doing, I think our nurses and our administrators who are doing this work, as Alexandra said, you know, kudos to all of them because it takes hours of their time to do contact tracing and to do it right. And as a school district, people in the audience probably are not aware, maybe the committee's not even aware, but every time we have a positive case, we have to submit that to the Department of Education, who keeps a weekly record that they publish. And we also have to submit that to our city health agent so that it's tracked on the city side to make sure it's wherever that information needs to be. Did I answer that, Maren?
Yes, thank you. So one of the other pieces that I've seen put out in communication from principals is that it also required it was both that and unmasked. So
Yeah, there is in the school guidance for the CDC and for DESE, there is mask language. And it does say in a classroom, it says an individual who is exposed to a COVID positive individual in the classroom, while both individuals were masked, so long as the individuals were spaced at least 3 feet apart, is exempt from testing and quarantine response protocols. So the way we determine that is if your child, Maren, is between 0 and 3 feet of the COVID positive person, we're contacting you to say your child's a close contact, and we are offering you either the option of test and stay if you're signed up for that, or we're offering you the option to quarantine your child. If your child happens to be sitting between 3 and 6 feet of the COVID positive child, we're calling you and saying your child was considered a close contact, but you are not, it's not necessary for you to quarantine or test and stay. Those two are not options for you. Now, you as a parent could decide, I'm going to err on the side of caution and keep my child home because they were within 6 feet. However, the CDC, DESE, and DPH all say it is not necessary for them to quarantine if they're masked. As a matter of fact, Bree, while we were in our COVID response meeting today, said she had just gotten she had just listened to a webinar for DPH, for the Mass DPH, in which they were reviewing that for city health people or whoever was on the call on their side, because that's kind of different from what they do on the city side. And the difference is because we are an extremely controlled environment. A school setting has layers and layers of mitigation strategies. So all of our guidelines, again, reiterate that this is the process we follow. Did that help?
Lori?
I don't know if I
I
finished.
appreciate that
Did I answer
explanation,
everything for Maren, though?
Dr.
we'll circle
Leclerc.
back around. Go ahead, Lori.
Okay.
I truly appreciate that detailed explanation, and I appreciate what all of our staff is doing to adhere to the guidelines set out by DESE and DPH. But as many people have said, there are many times when they don't agree, and they may be in agreement right now, and that's when it is helpful to have the additional advice of somebody such as an epidemiologist who is willing to sit on that team. I know that you said if things get trickier, you would ask for that advice, but we all know that Dr. Harvey is the one who is preparing the dashboard. So I believe it will be helpful now. There is a scheduling problem, and that is the only reason I wasn't there today, because it was scheduled when I had my own obligations at my own school. And I would like to say that with this supposed agreement with the DESE and CDC guidelines for kids in school and only having the exposure for contact tracing purposes within the 3 feet boundary. I actually heard from a health professional in a school today that DESE is already talking about the need to increase that to the 6 foot perimeter. So such as this type of change that's already coming up with DESE that hasn't gotten through all the grapevines yet, that's the perfect reason to have a health professional or somebody such as an epidemiologist reviewing this on a continual basis, because so often they make these changes. And once again, I will say publicly that I really feel that we did a better job than DESE and CDC guidelines because we were on top of everything last year. But I do thank you and your team and Sarah Mochek for trying to include me. In fact, you offered to switch it to another time next month, which also is a time I have obligations. So if we can work it out, or if there ever is an emergency, I will just have to ask for leave unless someone else wants to step in. But we all care about the community, and even though there isn't a school committee member on that, we trust Dr. Leclerc to bring back what is said as she did today. So thank you very much, Dr. Leclerc, for that.
I do trust Dr. Leclerc to report out, but I still, I can't say this enough. I really believe that every committee like this that I'm aware of has a school committee member. And I think it's important that all the different pieces are there and represented at the table. So I would encourage figuring out, Lori?
I just want to interject again, I'm sorry, but because people did compare us to Northampton, as often happens with our close communities, I did reach out to their school committee, and they also have limited the members on their team this year. In fact, there is not a school committee member on their team this year.
Yeah, well, that may be true. Yeah.
Yeah, they don't meet.
That may be true, but I would like to have a school committee member unless everybody else disagrees with me. And so I only have two things to say. I'd like a school committee member there. I'd like the meetings to be set up so that a school committee member could be there. I do believe that somebody would step in on a day when perhaps Lori couldn't be there if we knew in advance when those were going to be. And the other thing is right now, I think your plan, Dr. Leclerc, is once a month. And I just think that at some point, fairly quickly, we should prepare for twice a month, because I think it is, if things start to change right now, they're all going in the right direction, which is really good. But if things start to change, you know, I hope we never get back to once a week, but as need happens, I think we just should be prepared for twice a month. So I would just hope that you and the team are already thinking about that if the need arises. I always like to plan ahead and then not need anything, than try to scurry at the end. Did anybody else have any other questions about the COVID advisory team or the update? Lori, did you have something? Lori?
No, but once again, I kind of like meshed the two, because I actually got involved with that because I was the wellness committee, which really has taken a back seat, and we haven't had a meeting. So I'd like to bring that up again, that I really, even though we still have all of these COVID issues, I really would like to establish a wellness committee once again that meets regularly to work on goals of our community. And can I bring up just the important dates again and just make this a little bit of a wellness update from COVID to wellness, or if it's not the right time?
I think technically we should bring that down to other, but can you hold it till then?
Sure, but I used to have my place as wellness.
And we can put it back on the agenda for the future.
Even though I'm a sole wellness right now, I'll move to other. It's okay. I want us all to be well.
So anything else about COVID update? No. Okay. All right. Because we're going to come back to safety, and then we've got the superintendent's update, and then we'll have other. So I think we should be able to get everything in. We did get the definition of a close contact, and we can talk about that, I think, under the safety update or other. Okay, so let's do the superintendent evaluation update. This got a little late, but we had to get a few little kinks out of things. So hold on, I think I just moved my paper for that. Hold on 1 second. There it is. Okay. So for those of you who don't understand the teacher evaluation and superintendent evaluation, it's a little bit complicated. It is a list of goals that the teacher or superintendent or principal is supposed to meet, and certain standards to work on. And the way it works for school committee is every school committee member fills out that same form and does the evaluation. And then what happens is it all comes to me or the current chair, and the current chair goes through and looks at everybody's score and writes it out on the chart and makes sure that you average everything. So what I'm going to give you tonight is not each individual report, but a summary of the entire evaluation by all the members. So I'm going to start with some positive and negative comments, and then we're going to go to the actual evaluation and what those gradings were. So positive comments, there were many, many positive comments about Dr. Leclerc's COVID response. Comments that she and her team really did a planned and creative strategy for school, for education, for reaching out to students to enhance learning, and just working under really dire circumstances. And so there were many, many compliments on the work that she did. And we all know she was tireless in her constant need to change. We asked a lot of her. We asked a lot of ourselves, but we asked a lot of her, and she really responded. Another positive place was her continued work on the building school committee, the building team for Mountain View. And as we get closer to finishing the school, it's actually harder because I believe, tell me if I'm wrong, Dr. Leclerc, but I believe you're being asked to make decisions very quickly. They're trying to finalize so many things, and sometimes she's just asked really quickly with no advance notice to work on a particular aspect. So she has continued to work with that. The building's coming along. It's quite exciting. Another positive comment was her work on assessment for the air quality and getting the evaluation of the buildings and coming up with a plan for how we would improve the air quality and the safety for all of the buildings. Parent forums before the school year started. Dr. Leclerc did a number of parent forums where parents were able to come and ask the questions that were troubling them and get some answers. And then the one-to-one technology for students. This was a lot of districts were not able to get a laptop or a Chromebook in the hands of all the students. And Dr. Leclerc and her team worked really well. So those were a lot of really positive comments that showed up over and over on this. Some improvements that people would like her to work on are improving surveys so that they were a little more inviting of open responses from parents. Some of them they felt were just too limiting in their answers, almost like a yes, no answer without some sort of open-ended ability to comment on each question. The other concern was communication was, you did a lot of communicating and you did get recognition for that. But we still believe as a team that we need to be more proactive and communicate ahead of certain issues rather than be reactive. And the other last one was a need for a better translation program. I know that we are making progress all along and trying to do a better translation program, but the feeling is that we really need that in the community. So those were the improvement areas. And then one member felt that Dr. Leclerc needs to do more on equity. And two members felt that there shouldn't have been the gaps in food planning and delivery. As you remember, we had a pretty extensive food delivery program. But two members felt that it should have been fewer gaps and a little bit better delivery system. Overall, the team felt that Dr. Leclerc met her professional goal, her professional practice goal, and had significant progress on her district improvement goal. Instructional leadership, the team found her proficient. One member did find needs improvement, but the majority rated her as proficient. Management and operations, proficient. Again, one member found a need for improvement. Family and community engagement, proficient. Two members did find a need for improvement though, and professional culture. The overall grade was, evaluation was proficient, but one member felt there was a need for an improvement and one member found it unsatisfactory. So overall, when you put all of this together, Dr. Leclerc's overall rating came out as proficient. Okay. Any questions? Okay. And I do thank everybody who diligently fills those forms out because they're quite elaborate. And I know that every member does it while really thinking very carefully about what they're rating and what they are saying. So I thank you. All right, I'm done with my piece. Back to safety update. Do we have a safety update?
Is that directed at me? Because it's not, it's under your section, so.
It is under my section, and I believe the safety update was just to talk about the different, any concerns that we have, ask questions. I know you
So,
covered a lot.
Yeah, I mean, I can tell you, I think that school is going very well, and I don't want to paint a picture that it's perfect. There are places where we could absolutely make improvements every day. And every day we may try something new or something different to make adjustments and tweaks. Lunch is predominantly outside at every grade level. Students are adapting well to wearing masks. Students, we are starting to see the beginning of, I think, a tip of an iceberg as far as some of the mental health challenges that students have coming back into school. Some of them that have been either not in school for the past year and a half or have maybe never attended school, some of the little ones. We're seeing challenges around that. I think that our staff and our administration is pushed to the limit every day of what they can do. I think that not unlike probably every other industry out there, we are struggling to find people, and that impacts our daily operations. But on the positive side, we do have COVID cases, but to date, we don't have any in-school spread. These are not cases that are coming from spread within our building. And I know Megan Harvey's on this call, and I can hear Megan in my ear saying that I know of. But the reality is that in all the contact tracing, in all the cases that we've had so far, we know exactly where these children were infected, and most of them were kind of in their home setting is all I'll say. So our environment is very controlled. It's very structured. It's what I would say is much safer than a lot of other places where students go. I know that kids are safe when they're in the high school, and then they probably jump into a car with 4 or 5 friends and all take off their masks. So, there's only so much we can do. But I think that school is going well. And so those are the things that I'm trying to be very positive about. And I'll always be a cheerleader for the schools and for the staff and for the administration, because they deserve all the praise. They're working their hardest. I can assure you of that. Nobody is slacking. They're doing everything they can to ensure that kids are having the best experience possible. So that's what I'll say.
Thank you. The mayor had her hand raised.
Okay, hi. I just around safety and whatnot, I absolutely agree with Allison that the staff are working so hard and constantly move, what they're doing, whenever challenges come. I appreciate that. I do feel that it needs to be met around. I am pleased to hear that and school spread and the vaccine. I think that Easthampton Public is doing everything they possibly can to prevent spread. They're clearly, although very candidly, I don't really care about. I think we're doing a great job. Our example for other school districts, and I know that's because of Allison, her team, and her ability to react. And I appreciate that. That said, I also just want to.
Okay, Mayor, I'm just going to ask you one more, just for a second. You're breaking up, and we don't want to miss your statement. So I don't know if you want to log off and log right back on, and
Maybe
we'll
try
still
just
give you
turning
the
your
floor.
camera off.
Okay,
Try
I'll
turning-
and I'll turn my mic off. So go
Mayor,
ahead,
you
Mayor.
may want to go back because we missed like a third of what you said in the past minute. That's why I was showing my ear, because I bet it was wonderful. Could you just repeat a little?
It is better.
Yes, it's better.
I want.
No, it's not better, Mayor. You may want to
That's
log
actually
off.
It
and
is the
come
first
back on.
time. Okay.
So my only suggestion is to perhaps log off and come right back on, because we do want to catch what you were saying. And when you're ready, I'll mute myself.
Can I ask a quick question while we're waiting?
Sure.
Dr. Leclerc, can you again, just to go back to the contact tracing piece? You said that there's a certain, within 3 feet, there's contact tracing happening. Was there a different definition for because it sounded like from 3 to 6 feet, there was notification, but no required action. Is there a word for that?
No, you're still considered, your child would still be labeled a close contact. So if the nurse called your house, Marin, they would say that your son is a close contact, but he is within the 3 to 6 foot range, and therefore quarantine and test and stay are not necessary, but you as a parent may choose to quarantine your son if your son is high risk, say.
Okay.
Or if someone in your family is high risk, you may make that decision.
So
Okay.
I guess if I can
So
just
the
follow
nurse
up my
would
thought
call
and make
you
a-
between 0 and 6 feet.
Okay. I guess what I would put out there then, and maybe request whether it goes to our policy committee or goes to the COVID team or some place to have the conversation that should be had. I guess in my mind, and maybe it's about definitions, but if a student is in a classroom with another student that has COVID, that comes up being positive with COVID. We know that mask wearing is not perfect. As best as the kids are trying, they're still breathing through noses. There's still different things. They're moving around to go sharpen pencils. There's just a lot of movement, as well as even for all the good airflow that we do have airflow issues that moves around things. So I think that as a parent, I think that having notification that another student in my class with my child came up positive gives me more information. Just like you're defining that group that's 3 to 6 feet currently, they're being notified. There's no required action, but then I can make decisions for my family's safety based on our issues, whatever they may be. If we've got immune compromise issues or any other factors involved, having that piece of information I think is important. So I guess from my perspective, I would request that whatever the right group is to review that and to think about a little bit more when our students are in the same space and breathing this very similar air, even with airflows and everything that we've done to improve it, that some notification should be provided to parents who have students in the same classroom that comes up with a positive test.
So I would respectfully push back on that, and I would just correct you and say that it's not my interpretation. This is the CDC, DESE, and DPH guidance that we're following. We're not, interpreting it the way that we want. We're following that guidance, and we have the letters from the Department of Ed and DPH are for if your child is a close contact between that 0 and 6 feet, or we send a letter to the school community that there's a positive case in the school. There is no kind of in between. And I think there's a reason, there's a couple of reasons for that. Number one, if we were to notify you that someone in your class is a positive case, then there would be a lot of speculation trying to determine who that was. And I don't think it's necessary. The CDC, DPH, and DESE all say it is not a risk factor for us to be considering. There are far more riskier things that children are doing than being on the opposite side of a classroom. And people may disagree with me, and that's fine, but I'm saying I'm not the medical expert. And in the absence of my medical expertise, I'm going by the CDC, DPH, and DESE. And, and even, we could ask our school physician, but again, I'm not sure that our school physician would say that they have more expertise than the CDC, DPH, and DESE, who are all saying the same thing.
I understand, and I'm raising my own concern as a school committee member, and I'm just asking that, and I understand that there are pros and cons to communicating it out to more students beyond just that 6 foot range. But how we define that 6 foot range is maybe by class desks where, again, students move around. So what I'm asking is not that my personal opinion becomes policy. I'm asking for you to take it to the COVID advisory group and just raise that question there to reiterate the conversation about how we define things. And again, I would not suggest that we would add to the definition of close contact, but again, with our, an edge more conservative than some of these state and federal government agencies are, look at, is there a way that we could feel that it would add a safety factor by looking at that? So it's just something that I would like the professionals that are in our community to have that conversation and review that as a possibility.
Okay, so Mir, can you try again with some of your comments? And I'm going to mute myself, and Mirren will mute, and we'll see if we can hear all of what you were saying. If you're ready.
Is that better? Okay. Yeah, so I would just go back to Allison's comments about the staff and herself, the admin team. I do think that, I know that they're working incredibly hard. They're working on, kind of their tippy toes as things shift. I think our district is stronger for it, and I appreciate that very much. And also recognize the stress of everyone who's working in our schools, regardless of their position, to make the schools as safe as they can be, also have life outside of work, and they are on top of it, having everything we're dealing with as individual people. I do just want to bring up, and I will also say that while I don't really care about any other school districts as mayor, I'm not responsible or connected to them. But I would also agree that Allison's team is definitely exceeding and really showing what you can do with COVID and having the schools be safer. That said, and the but isn't to the school department or anyone in it. The spread of COVID-19, we have to do everything we possibly can. And so while we talk about school spread and whatnot, for me, it's doing every possible thing that we can do, and up to like including close contact, making it longer. Quite honestly, and I not suggesting we do this. I mean, but if we were really going to confront COVID-19 and lock it down in Easthampton, schools would be closed. Now, again, I'm not saying we should do this, but the bottom line is, if we did everything we possibly could do for mitigation of COVID-19, it would really right now go back to where we were last June. And I just want to put that out there. I think that there is a misnomer that there is a safe level and infection rate will go down, and then complacency. And it's just not the truth. And if it was, I wouldn't have had to put in again a mask mandate in the city. And I just think that has something to be said around. I do think that, and when I talk about shifting and responding to everything new around COVID, what is risky, what is not best practice, what the recommendations of the CDC and the DPH and DESE, I trust. I'm about science. I'm about, like, they have departments that think, but I do understand the concerns, the confusion, when these very well-known agencies put up guidelines and they've changed a lot. Even Dr. Fauci, right? Don't worry about mask. And again, I'm not flaunting the science, but I do want to remind everybody that we know so little about COVID-19, and we have had to move so fast. And that's what our school district has done, I believe, as well as they possibly can, as they've moved fast to really get to as many kids as they can and meet all the needs. Nobody's perfect, all of those disclaimers. But the reality is COVID's still in charge. There are just so many things we don't know, and complacency just has no place in our society right now. And when the parents, are talking about autoimmune or just plain, blanket concern and fear for the health of their family and their students or whatnot, I can understand that. That rings, true to me. That said, just rolling into a little bit. So that said, and I'm just, so if I understand there's no remote education, if a student if a student cannot mask because of a medical issue, whether it be physical or social emotional, and they choose to go, they find it very stigmatizing that they don't wear a mask, and they choose to stay or want to go remote or, do a true, I don't know what this, honestly, I don't know what the solution would be, or have a family member that's very compromised with a doctor's note for either one of those circumstances. Is that treated differently than just say, like, I'm not going to let my child go to school because I don't, because that's my choice. I just worry about, even if it's one or two kids, I understand. So I just worry about that. And I remember in the special ed world, I don't even know if they have them. They had those, I don't know, the 501c3s. No, that's the home hospital plans.
Yeah.
That would put together educations for a whole bunch of different things, but never a virus, because we've not had this. So I am just worried about that. That was long, but I do appreciate, understand and see, driving by the schools or popping into a school, the effort, and everybody is doing everything they can with what we know. But Megan's on the call, and I'm sure when I say, if we're going to do everything, we should shut down the schools, I'm sure she's I am not suggesting that. I'm just making a point, that, all the employees in City Hall would go remote and stuff like that. So next is remote in severe or limited cases about kids somehow participating while not going to a physical school. Are they just out of luck? I mean, how does that work?
So, so a few things. So I think it was last week, the Department of Education, in response to some pressure I think they felt around that very issue, released information to school districts that we may purchase a seat for a student that falls into that category that you described, Mayor. They're unable, because of a medical reason, to set foot into a school building for the year.
Yep.
We're not talking for a couple days, we're talking for a year.
Mhm.
So they would be able to go to a remote school. That does not mean that they would have any relationship with their Easthampton teachers or classmates. We would purchase a seat in a remote world for them to go to. So knock on wood, we haven't run into that case here in Easthampton. I don't think it would go over very well. I don't think I don't want to speak for the families in Easthampton, but I don't think that they would like the idea. I think they would weigh that carefully, because they are so invested in our schools and our staff. For students that have to quarantine because they're a close contact, if they're not doing the test and stay in school, they're in our district, they may be able to Zoom into their class. We're still working with our teachers union around what that would look like, but it would not look like hybrid, which is a term many families would recall from last year. You wouldn't really have any interaction with the teacher. The teacher would simply have the camera on, and kids could be watching what the other kids are doing in class. And as long as the child, I should preface this all by saying, if a child is at home and not feeling well, their priority should be to get better and not worry about Zooming into a class. But we have offered that to a few of our students that are quarantining. And, I will say that a lot of our students are doing test and stay. We have started test and stay. And of course, our high schoolers that are vaccinated and some of our middle schoolers, quarantining or being a close contact is not an issue, because you're not a close contact if you're vaccinated. So, it has severely decreased the number at those levels. But yeah, we're still working on that piece with the union, but that would only be a short temporary fix.
Right.
And it would not be anything as to what parents recall from last year.
Yeah. No, thank you. That's helpful, because one of my questions are like, for those students, is a remote school an option, because I've been reading, but perfect. I get the context now. Thank you.
Shannon?
I was just curious, Allison, you just mentioned vaccinated students aren't considered close contacts?
That's correct. No vaccinated individuals are considered close contacts, staff and students.
I'm sorry, why is that?
That's I don't know the medical reason why, but if you're vaccinated, you're not considered a close contact.
Even though we're still susceptible to the Delta virus, the Delta?
Yep.
There is no such thing as 100% vaccine, coverage. I mean, there are, while it's very, it's excellent and covers most people drastically, and we should all be vaccinated, but it's not 100%. You can still get COVID.
Mm-hmm. Right.
I guess that's
I'm not
another
arguing
topic
with you.
that I
I'm
would
just telling
certainly-
you what the definition, that's a universal definition by every organization.
So wait a minute, we're all flabbergasted with your last statement, and thank you, Shannon, because that's exactly what I was going to ask. So are you saying that the CDC is saying that vaccinated people can't be close contacts, because that flies in the face of every?
Yeah, they all say it. Yeah.
As of what date? Can you tell me?
As long I will tell you, the DESI guidance is from August of 21. The CDC guidance is from August 5th. I don't know the exact date of the DESI DPH. I think it's around August 20th. Asymptomatic, fully vaccinated close contacts. Individuals who are asymptomatic and fully vaccinated are exempt from testing and quarantine response protocols. And that would be the same for staff, for our adults. And, Cindy, as a teacher, if she had a close contact in her classroom, she's vaccinated, so she doesn't have to stay home.
Wait, but there's a difference between saying there's a required action that you have to take, like being quarantined, versus being notified that you are within 3 to 6 feet of someone who had COVID.
Correct.
Those are two very different sides that are different. I mean, that's a very different perspective, that people should still be notified if they're within, whatever distance ends being the right definition, but that if we're not even notifying them just because they're vaccinated, then there's a chance that they could be getting symptoms, they don't have it yet. So that doesn't make no sense.
Maren is correct. They are close contacts, but they don't need to quarantine.
Correct.
That's the difference.
Yeah, but Dr. LeClaire, it sounded as though you were saying they wouldn't be notified as close contacts. I do understand they wouldn't have to quarantine, but were you saying that they do not have to be notified that they are close contacts? Because I do agree with Maren.
I don't think in the examples that I know of in our school building, we have had any examples of that happen yet. I would imagine if they were within the 3 to 6 feet, they would be notified. I can double check with the principals. I know of a few examples where students were informed of a case when it impacted a team, for example. Because keep in mind, I know an overall percentage of people that are vaccinated, but I don't know personally if you are vaccinated unless I ask you. That goes for anybody in our schools right now. I have to ask the question of a student or a staff member.
So, but my sense
So the nurse or whoever's doing the contact tracing would call them to say, are you vaccinated?
Okay, so maybe then either you misspoke or misrepresented that statement, but as long as people are getting phone calls to notify And then
Yeah,
what their
because right
course
now
of
we don't know
action
who,
is.
yeah, right now I don't know who's vaccinated, adults
Right,
or
so if their
students.
course of action can then be determined based on their own vaccination status and their own choices, that's different than us not giving them the information or their parents the information.
Correct. I totally agree because there's too many cases. Yes, vaccinated people are not getting really ill, thank goodness, but we know that they can transmit to an unvaccinated person. So you need to know that information. So I hope that we clear this up and kind of redefine it right now. And
Yeah, we
I'm-
would be contacting them because we don't have the data on who's as a school district, we have not asked students and staff to provide that to us. So we have to ask the question.
Okay, good. But if I said, yes, I'm vaccinated, does that mean you're not going to tell me that I was just next to somebody for a long period of time who's positive?
No, I didn't say that at all.
Okay. Well,
We would go through this information with you.
okay. Okay,
Yeah.
great. Okay. They just aren't going to have to quarantine. Any other questions about all this? So Lori, go ahead, Maren.
I just want to say, I appreciate, I feel like you just got on the hot seat and I understand that there's so much, sometimes it can be really splitting hairs about how we talk about things or how we say certain things. And there is, especially with medical information. So I appreciate you sitting through that conversation and being able to work it through and make it clear so then we can be clear to parents about when they will be notified and things like that. And like I said earlier, I think that we should consider notifying them, even if it's beyond what's defined as a close contact. But I do appreciate you sitting through that conversation, being able to work it through and being able to be clear with our parents. Thank you.
Thank you for giving me the chance.
Thank you. So Sue contacted me and let me know that the agenda where it says safety update is really safety and wellness. So that is your area, Lori, to be able to finish and say anything. Just in the future, what we'll do is put safety and wellness as we used to. Does that
But
clear
Madam Chair,
that
those
up?
are two different committees, actually. We have a
Right.
safety committee.
Right, but what
and
I'm
a
saying,
wellness committee.
what I'm saying is we'll put safety and wellness, back in line. She was feeling that we were putting them under both, and we'll have each one spelled out next time. Does that make sense? So if you wanted to talk now instead of waiting for other, you would be able to do that.
How about
here
if I
tonight.
speak both times to not
Sure.
confuse what I have to say? Because
Sure.
I have an other that isn't wellness, so I'll save
Sure.
that. But
Sounds good.
once again, we want to promote wellness, and we've been so fortunate to have our liaison working so closely with our team. I want to thank Jeff Bagg, our city planner, who's been working so hard with our Safe Routes to School coordinator, who was on one of our meetings. And the bike rodeo is all scheduled for October 2nd, and it will be from 1 to 3 at Millside Park, which is off of Ferry Street. There is a rain date of Sunday, also 1 to 3. It's for kindergartners through 8th graders. There's a wonderful poster. I mean, I could ask to share the screen right now and show it to you, but schools did get it, and it is on the city planning website and Facebook page. And Dr. Leclerc, if we could share it also to our district page. But I need to share 2 events. So the rodeo, as I said, will be occurring the weekend of October 2nd. There'll be helmet fitting, and some helmets will actually be provided there. There's a certain number of helmets if people need one. Bike basics and safety riding skills. They'll learn street crossing and basic hand signals. Our police department will have representatives there to help out in this day. There'll be minor bike repair. There's really a lot going on, and Valley Bike will also be there to help parents learn about access to their bicycles. So,
Lori, I just shared the screen with you if you want to show that.
okay. So it is a wonderful event. Let me just see. files. You know, I'm not going to take the time to call it up. I had it and it's
Okay.
not there. So I just don't want to
Okay.
take people's time, but
Okay.
it is, and we'll post it on our school site. So,
Awesome.
okay. And then also I have to create another poster. There is a save the date on the bike rodeo event for the Wednesday, the following that. I mentioned it at our last meeting. We are going forward with a bike walk and roll event. Don't expect bagels, but maybe we can get some type of snack there. We do want people to be masked and safe, but we want everyone to have fun. We had such a great event in the spring. It was really heartening to see, like, we really couldn't see their smiles, but you could tell from their eyes. They were smiling to be together and going to school in such a great way. So that will be on Wednesday, and I haven't talked about a rain date. That's what we need to discuss, Dr. Leclerc, with your team of principals. Is that something we want to do? Just have it the next day or the next week? And what we've done is we've had the 7:30 start date for Whitebrook start time, and then the 8:15 start time for the elementary schools. And we'll all start again at the safety complex, because that's what we decided in the spring, that everyone likes to meet together and go to their schools. So if anyone has any questions, please email me. And I hope to be there. I'm not sure I can. So if anyone wants to volunteer, that's great. And we have lots of giveaways like we did last time, the reflectors and the safety reflector bands. So thank you. And I'll say other and other. So thank you for letting me speak in wellness.
Yeah,
Be
thank you.
well.
And we'll clean that up for the next time. Okay, we will go on to our superintendent update.
Thank you. So I think in your package, you received information about our student enrollment figures, and I'll just briefly summarize some of the information. Our total student enrollment this year is 1,415, which is about 45 students less than last year. We were at about 1,461 last year. And we've had, there are decreases in a few students here and there. At Center, we had 188 students this year. We had 193 last year. At Pepin, we had 189 students last year. We have 176 this year. At Maple, we had 191. This year, we have 186. At Whitebrook, we had 445 last year. We have 426 this year. And at the high school, we had 421 last year, and we have 401 this year. I don't think it's a bad thing. We have had to limit the number of school choice slots that we're opening up. And it's primarily because, excuse me, at our elementary schools, we are very limited by size. And in order to keep 3 feet of space between students, we really had to decrease the number of students per classroom. So, and kind of move things around a lot. We had to be very creative in our spacing. So some of our classes are smaller than they have been in the past, but they're safer. So it's kind of a trade-off. And I feel pretty confident that once we go into the new building next year, we'll be able to recoup some of those school choice slots if we so desire. And the enrollment at the high school, we have had decreasing enrollment at the high school for the last few years. Again, we have not pushed to add a lot of 9th graders to the program. We could probably add a few more 9th graders this year, but because of COVID kind of things, we've been pretty cautious with that. So I think that, not to say that we don't have any school choice slots, but we used them very strategically, and we really looked at our spaces to ensure that we could optimize students spread out as much as possible. So that's kind of the price we're paying for it.
Thank you.
Mhm.
Any questions about this? Okay.
And the other piece on the agenda is I just wanted to, Marissa asked at the last meeting about the school start times. So we have a letter that's going out to parents in the next week to lay out kind of the options and to give them a summary of why we're exploring this option. And we have a survey that we have developed that will go to families and staff and students, predominantly the older students, middle school, high school. I mean, just high school, because we're not talking about switching the middle school times. And Jean Libby has been working on both of those with me, the document going out to families and the survey. And I will look at it again with the information from the group that did the evaluation about surveys. There are a lot of open-ended questions on this particular survey, but Jean and I will take a look at it again tomorrow before it gets ready to go out. But I really wanted to make sure that the information we send out to parents is not coming out at a time when they're getting so many other messages, like all the COVID stuff. So I wanted to have it kind of stand on its own. So we have something ready to go out to families, and I'm hoping I can report out to you on the results at the October 12th meeting. And we can go from there. You know, we're offering the option A, which is to keep things status quo. The option B is to flip the high school and the elementary schools. And option C is really just asking parents, do you have any other creative options for us to consider? I will be honest with you. I don't know how it's going to go because I think there are a lot of obstacles to overcome. I think there's a lot of research that this is a very good choice to make. Someone asked me today, well, could all of Mountain View just start school at the same time, grades pre-K through 8? We don't have anywhere near the busing to make that happen. Not even close. Not even if the mayor gave, well, if she gave me like $1 million, maybe. But the reality is that we have, there are things that prevent us from maybe doing exactly what we want. So, you know, there will be some challenges around that. And I think for many families, this will be a personal choice because there are a lot of things to consider. I know that some families are worried about sports, but I know from other communities that there are a lot of high schools that are exploring this option and or have already done it. So the sports issue almost becomes a non-issue, but then there are students that are working. How does that impact their jobs? There are students, the older students sometimes babysit the younger ones, so they really do need to get home first. I know if you Google it, Northampton had some articles in the paper over the summer. They were challenged by childcare. After putting this decision in place, they didn't think through all the ramifications for the need of childcare in their community, and they struggled. So that's a challenge in our community, I would venture to guess, because we have a lot of kids in after-school care or before-school care. So there are a lot of challenges associated with this. So I'll be very interested to see kind of how it pans out. I don't think it's going to be a dramatic decision one way or another. I think families are going to be very kind of torn about this, but I want families to take away tonight that we're just exploring this option. And, you know, we're going to wait and see what it tells us, and then we'll have further discussions around it. It doesn't have to be a a done deal. I don't believe. So that's the information I want families to get. And I hopefully will provide an opportunity for families to give us that feedback in the survey.
Go ahead, Marissa.
Yeah, thank you. I really appreciate you getting the ball rolling and the work that you and Jean have put into that. I do totally think that childcare is one of the biggest concerns around this issue. And so I would love to see if there's some way to get involved in this conversation, some of the major childcare providers in the city. I think that there's challenge, but there's also opportunity. I know for a lot of working parents, the current start time for our elementary schools is too late for a lot of people who need to get to work. And so a lot of families are having to balance childcare on both ends of the day in order to accommodate a full working day. And so I do remain optimistic that there could be a way that we could work with childcare providers so that way, at least it's consolidated on one side of the day where they have more hours on the end of the school day in childcare where there's a lot of childcare need, but fewer of those transitions from kids who are having to go to a morning program and then school and then an after school program. So, I know we have partnerships with a lot of people, Young World, Our Lady, the EASP champions, and it would be great to kind of bring them to the table at some point and see what ideas they have for accommodating a shift in need there.
Mm-hmm. Yep, I agree.
And I do agree, it's a very complicated issue. We tried it in our district. We sent out a survey and we got those same answers. There were a number of elementary school parents who felt they needed to get to work. And so they wanted the earlier time, but there were so many that wanted their older kids to be home already to receive the smaller children. So there was just this myriad of answers. And it's a gargantuan problem, and there's just so many factors to figure out. But I think it's a great conversation and a really good thing to explore. We know it does better for teenagers, so that's not necessarily helpful though if we can't make it happen. So I do appreciate you doing this. Any other questions about that? No? Okay. Well, thank you, Dr. LeClaire.
You're
I'll be
welcome.
interested to see, just what you end up with for answers from that survey. And I'm sure the rest of us will. Marissa, time for you.
All right. I make a motion to approve the school payroll dated 8/26/2021, the amount of $386,836.67.
I'll second.
Okay, Lori,
Laurie Garcia, I.
Shannon,
Shannon Dunham, aye.
Jonathan,
Schmidt, aye.
Mayor,
Mayor LaChapelle, aye.
Marissa,
Marissa Crary, aye.
Maren,
Maren Goldstein, aye.
Cindy Kuzensky, aye.
I move to approve accounts payable authorization for payment dated 8/26/2021 in the amount of $184,936.40.
I second
I'll
that.
second.
Lori,
Laurie Garcia, I.
Shannon,
Shannon Dunham, aye.
Jonathan,
Schmidt, aye.
Mayor LaChapelle,
Mayor LaChapelle, aye.
Marissa,
Marissa Crary, aye.
Maren
Maren?
Goldstein, aye.
Cindy Kuzensky, aye.
Motion to approve school payroll dated 9/9/2021 in the amount of $555,007.02.
Second that.
Lori,
Laurie Garcia, I.
Shannon Dunham, aye.
Schmidt, aye.
Mayor LaChapelle,
Marissa-
aye.
Marissa Crary, aye.
Maren Goldstein, aye.
Cindy Kuzensky, aye.
Motion to approve accounts payable authorization for payment dated 9/9/2021 in the amount of $229,801.95.
Second that.
Laurie Garcia, I.
Shannon Dunham, aye.
Schmidt, aye.
Mayor LaChapelle, aye.
Marissa Crary, aye.
Maren Goldstein, aye.
Cindy Kuzensky, aye.
We have two budget transfer requests. Dr. LeClaire, did you want to just mention what these are about?
Sure, they're just some movement within the IT department to cover the renewal of some of the software renewals and licenses.
Okay, great. So motion to approve the budget transfer request for $9,650 from instructional technology supplies to admin tech other.
Second that.
Laurie Garcia, I.
Shannon Dunham, I.
Schmidt, aye.
Mayor
Marissa,
LaChapelle, aye. Oh, I'm sorry, Marissa.
no, I was out of order. Marissa Curry, aye.
Maren Goldstein, aye.
Cindy Kuzensky, aye.
Motion to approve budget transfer requests for $9,650 from instructional technology hardware to EHS.
I'll second that.
Correct.
Laurie Garcia, I.
Shannon Dunham, I.
Schmidt, aye.
Mayor LaChapelle, aye.
Marissa Curry, aye.
Maren Goldstein, aye.
And Cindy Kuzensky, aye. Okay, now we are at other. Does anybody have another other? Lori?
Well, just to add to conversations that can be extremely complicated. So we have our timing issue and we have a new issue that I would like to bring to everyone's attention. I've mentioned it before, but I'd like there to be further discussion of our school calendar. So since I became school committee member, I can tell you I have appreciated tremendously that the schools committee, especially Sue Colby, contacts me and she checks when the high holidays are for the Jewish religion to make sure that we don't schedule meetings. Unfortunately, I was not aware that there was going to be the visiting day for kindergartners on Rosh Hashanah this year, because I don't see all the school different dates and events. And that really presented a challenge to our Jewish families to decide if their child was going to visit the school or observe Rosh Hashanah, which is one of the highest holidays of the year. A few years ago, I brought it to everyone's attention that, you know, and I don't know if Omar's still on, he isn't, but Feliz Mes de la Herencia Hispánica, there was the opening event scheduled on Yom Kippur, and I had to really say that that was not okay and have a meeting with the people that were organizing it to explain the significance of Yom Kippur, which is the highest holiday for the Jewish people. So I appreciate what the community has done, but I can tell you that this topic has opened up a whole can of worms on social media. I happen to be a member of the Jewish community page in Easthampton, and I got involved in strands to try to help, to try to say that our school committee is actively trying to respect all of our cultures and religions. And people did bring up the fact that Northampton this year and Hatfield both have taken off Yom Kippur and Rosh Hashanah. And I grew up in a town in Eastern Massachusetts where I never had school and they still don't have school. I've worked in districts where they're on school, but the Jewish member of the committee said, I'm not sure that our population warrants that because I have to look at fairness to everybody. We have other cultural traditions, for example, Reyes Magos, the Three Kings Day on January 6th. Are we willing to have that day off? And then what about our Asian population? Are we going to have Lunar New Year off? And our Muslims, depending, like this year, Eid is in July, but some years, Eid, the end of Ramadan, which is a very sacred celebration and joyous, that sometimes is even during MCAS, which is another horrific conversation. But what I'm saying now, we don't need to get into this because this is other, but for our calendar next year, because this was all brought to the attention, I actually put a question out on the listserv for the Mass Association of School Committees because I wanted to know what's going on in the state. I got some fascinating answers. So I'd be happy to share those with you. Some districts have added and some districts have taken away. So that's a whole calendar issue. And I actually volunteered to co-chair a roundtable discussion at the conference in the fall to discuss it. But we need to think about ways to include explanations of these holidays so nothing is planned on them at the very least. And Melissa Weinberger actually brought it to the attention of the Equity Committee. I posted the invitation on the Facebook page to invite other Jewish people to go there. Because if they have so many concerns, then they should take part in the equity discussions. So this is all a conversation that we can open up and also add it to our many conversations that we continually have, that there are two sides to everything. So thank you.
Thank you. And Mayor? Did you have another?
I did. I had two others. One, we've been reading in the paper about other school buildings and municipal buildings with mold and whatnot. And I'm wondering where Easthampton is on that.
You want me to respond to it now? I'm sorry, my house phone is ringing at the same
Okay.
time.
Yeah, no, if you could just, I mean, it might be a more in-depth, but just a quick comment would be
Yes, I can
appreciated.
give you a quick comment. I've communicated to families at both the high school and at Center School that mold had been found earlier at the beginning of the school year. The problem is in both cases, we have hired an outside consulting company, Green Environmental Consulting. They're located in Easthampton, and they specialize in this. They've come in, they've already completed the assessment at the high school. It was just on some guitar case covers is where it was in a closed storage area. And that is being abated by a company called, I think, Abide. It's a remediation company. They're going to come in. They'll abate the situation safely with scrubbers and closing off the spaces. So that's done. At Center School, there was mold found on a table surface in a basement. And so we basically, if you've been in that building, it's very old. The basement is old, so we basically are not holding any classes. We're not using that space for offices. We've moved everyone out of there, and they took air samples, but we don't have them back yet. And then we'll abate that area with the same company. The same company took the air samples, and then we'll have the same company do the abatement, the Abide group. That's probably a month out because these companies are all quite busy. And in speaking, I had a lesson in why this is happening. And the gentleman that owns or that is the consultant for Green Environmental said, this is a problem probably in every school across the state of Massachusetts because we were directed, because of COVID, to maximize outside air flow into our buildings. So we all did that. And then when we had very rainy weeks in August and high humidity, it caused mold to grow in all of our buildings. And he said, well, if you want to avoid that happening again, don't have your HVAC systems pulling in the maximum amount of air on humid days. And so that's really the reason across the state of Massachusetts. And I don't mean to belittle it. I know people have mold sensitivities, including myself, but this seems to be due to, it's not due, in our particular case, it's not due to any leaks. This is due to humidity and maximum airflow in our spaces. So I forgot to also mention that in the basement at Center, we have really optimized the dehumidifier situation in all those spaces. So that's my mold update.
Great, thank you. And then the other thing again, reading in the papers, but also hearing about it in my office, transportation. And I know the AD is using the van, the 15-passenger van we got in the beginning. And I know you were really worried about number of buses and how we were getting kids to school, and how are the bus routes how are those doing?
Well, I mean, I've got my friend Marin on this call, and he will tell you from the finance subcommittee
Yeah.
perspective that we're looking for buses every single year because in Easthampton, we simply don't have enough buses to transport all of the children that really need transportation. They might live within a short distance of school, but perhaps there are no sidewalks on their street. There are all
Yep.
kinds of reasons. Families have a lot of issues. There are childcare, daycare issues.
Mhm.
We only have about 7 buses in Easthampton. We don't have enough to meet the demand of the families in Easthampton. And every year it becomes greater and greater. And last year, by having such flexibility in our busing and not denying anyone, because many families chose to drive their children while they were working remotely, a lot of families then had the impression that they would be able to access the bus again. And so we've had to say no to a lot of people.
Yeah.
I don't need to tell this committee that there's a shortage of bus drivers across the state of Massachusetts. It complicates matters when the person that is the manager at the bus garage has to also drive a bus because they don't have enough bus drivers. So it's problematic across the board everywhere. I don't think I need the National Guard. I really need more buses to appease everyone. And I know, and the finance subcommittee, we've talked for the past several years, once we move into Mountain View School and everyone's mileage distance gets recalculated, when 7 buses is not going to be enough. I just know it's not going to be enough to accommodate the sheer distance that people will be qualifying for. So we're doing the best we can. That's what I would want families to know. And, I've had to say no in some cases, and that puts a burden on families, and I understand that. But I can't meet every need. We simply don't have the buses, and there's no way to get more buses, right now. You have to order a bus a year in advance. So it really, and they're a couple $100,000. So it's not an easy problem to solve.
And that my 2 follow-up questions. One is, as I remember, when we're in the new school, we actually need more buses because of the location. And then the other is even to buy, I think you answered it, but even to buy more of like the big buses or 15 passenger or even vans in a pinch, if we ordered them today, how fast would they come? Because we're ordering cruisers and ambulances, and they're telling us it's 26 weeks out. That would be the
I
soonest.
don't even think buses would be that easy. I think 26 weeks would be very optimistic. Normally for buses, and I can't speak for 15 passenger vans, but usually you order them about a year ahead of time. You order them this year for next school year. And they're a couple $100,000, which, we don't necessarily have that much money lying around, and it's hard, I will say that, and we could do this graphically, but years ago, I think when I first started here, we were maybe transporting 2 students to Hilltown Charter that qualified.
Yeah.
Now we're transporting a dozen. That's a charter school. Those kids are not accessing our school, but we are mandated to provide transportation on our buses. Those students take up 12 seats that I can't give to our students. You know, so that's a challenge. I have more students going to Smith Voc, more students going to CTech. You know, I don't think the community wants me to say no to those students, but when I fill up, you know, I need 2 buses just to do the CTech runs. So that impacts the entire cycle. And I need a bus to do the Smith Voc run in the morning. So that means I only have 4 buses for the high school, the regular high school run. So it's just a very complicated puzzle to figure out.
No, right. And we want to, yes, it's a burden for the families. I'm sure that will shift even more with the new school, you know, and the charter schools and Smith Voc. I mean, they're all Easthampton students, and trying to figure out the transportation. I actually looked into buying more big vans that maybe could qualify, or bigger buses. And it doesn't, you can't use ARPA money for it. Because it's not because of COVID, it's more to do with the shortage before and then our new school. So
Yeah.
I'm thinking about it, but I was wondering if school buses were as backed up as what we're seeing with other municipal light vehicles. So thank you for walking me through both issues. I appreciate it.
And I'm happy to follow up with you. I can talk to the bus company this week and follow up
Yeah.
with more specifics on that for you.
Does it help if we have, like, we use the estimated numbers and the new school and run expected routes and expand our bus contract now?
Yes, I think that would absolutely help. And we are in the beginning stages of having that conversation, but it's difficult for the bus company to do that additional computation right now because they're short-staffed. So
Great, okay.
Yeah.
Yep. We're all in the same boat, just in different
We are,
departments and
yeah.
fields. It's, no
Yeah.
different here. No, I mean, whatever I can do. I know it's something everybody across the state is experiencing. I'm worried about those parents and balancing start times and end times and working schedules. So thank you.
Mhm.
Any other? No. Ooh. All right. So do we have a motion to adjourn?
I will move to adjourn.
I second that.
Okay. And you've all switched places. So Maren,
Aaron Goldstein, aye.
Mayor LaChapelle,
Mayor LaChapelle, aye.
Jonathan,
Schmidt, aye.
Lori,
Laurie Garcia, aye.
Marissa,
Marissa Curry, aye.
Shannon,
Shannon Dunham, aye.
and Cindy Kuzensky. Aye. Thank you very, very much. Have a great night.
Good
Stay
night.
safe.
Night.
Good night.
Recording stopped.